Welcome to Nurse Deck. I am your host today. I am Jamie Smith. I am a nurse practitioner here in Southwestern Virginia. I am the Chief Educator and Compliance Officer for Premier Geriatric Solutions and then the author of Geriatric Notes. We are very excited today because we have Dr. Katie Boston-Leary with us today. Hi there, Katie.
Hi, Jamie. Thanks for having me.
Yes, ma'am. Excited to have you here. Please introduce yourself.
Sure. I'm Dr. Katie Boston-Leary. I'm the Director of Nursing Programs at the American Nurses Association. What does that mean? I oversee the Nursing Practice Work Environment Division and Healthy Nurse, Healthy Nation. I also I'm also an adjunct professor at the University of Maryland School of Nursing in their doctorate program, and I teach nursing leadership courses there. And then I'm also an executive coach, so I have my own a nonprofit where I provide coaching support and services to leaders or want to be aspiring leaders, and I offer some discounted pro bono services for nurses of color. So that's me in a nutshell.
Wow, that's awesome. Sounds like you stay pretty busy.
I do. I'm sure you do too.
Yeah, I do. So tell us, Katie, how did you get started in nursing and what drives you to be a nurse?
So it was an accidental stumbling into the field, I must say, because I did not have a lot of role models or people in my family or my circle at the time that were nurses. So it really happened, but it was supposed to happen clearly. And it was an opportunity where I lived, where they were looking for young people to enter into allied health careers. And because the county saw a shortage and I applied, I was living in Virginia at the time. And that's with the urging of a coworker who was older and wiser than me. And he kind of kindly threatened me to seek the information and bring it back and not return to work if I didn't. And I complied. And I went to the line where I thought I wanted to be an occupational therapist, and I was running late to go to work the next day, and I hopped into the shorter line, which was a line for the RN program. And that's honestly how I became a nurse. So I filled out the application, got called, did some interviews, did an essay, and that started my career. But regardless of how I stumbled into it, it's been a love of mine, and no regrets whatsoever.
Well, that's awesome. Thank you for sharing your story. And I think that says a lot too. You stumbled right into nursing, right where you're meant to be, and especially if you didn't have family members or anyone there setting the example, or, you know, it just sounds like you were where you're supposed to be. So,
absolutely. No, without a doubt.
So tell us, what are your thoughts on our current healthcare system, and what do you think needs to change?
Well, there are people that would say that our healthcare system is more of a sick care system. We also tend to manage health on the downstream effects versus the upstream, and not really addressing the root causes. There are other places in the world that try to focus on health from in utero, from preventing your next readmission in the womb. Mm-hmm. And we're usually pretty late to the game. We have a major health literacy issue in the U.S., which is really clearly evident during the pandemic, right? So we have some work to do with our healthcare system. But what holds our system up are a lot of dedicated, compassionate, and intelligent healthcare workers. I speak for nurses that hold up our healthcare system in spite of all its flaws. And I also believe that to move the system in the direction it needs to move, nursing needs more of an emphasis and presence in healthcare, where they're practicing at the highest level of their licensure. And that's the way to hopefully move in the direction that it needs to, particularly as it relates to focusing on wellness and prevention.
Thank you. I like your response to that. So, so how do you become a nurse leader, and what? See, okay, nurse deck, delete this. I'm gonna restart that question. Okay.
Sure.
On the count of three. 1, 2. So thank you for your response to that, and I respect that 100%. So next question I have for you: how do you become a nurse leader, and what tips do you have for those who are interested in going down the same road?
Yeah, well, first of all, you have to want it. And there are a lot of, unfortunately, a lot of people pull into leadership because of certain, attributes that they have. And then they get pulled into it and they don't get the training and support and education they need to excel. So the first step is, which is something that I try to do, is as a leader myself, I try to role model what it should look like, right? And not portray myself as a pillar of perfection, show my vulnerabilities and my flaws so people know that you don't have to have it all together to be in a leadership role. And then also encourage people to not just enter the role, but do what you need to do to stay there. So you want to make sure that you have the education and training to give you a framework to be successful. And then third, definitely setting up your structure of support or your support system to be successful. Set up your mentor, your coach, your professional junior that you're mentoring yourself, a professional peer that you can soundboard off of, and also, again, your role models and your mentors are important. But I also add in the fact that have a loving critic at work, where it's someone that, like what your mom will tell you when you show up for Thanksgiving, and she'll tell you that you're losing weight or you're too fat. Same way at work, you have someone that can tell you honestly how you're doing, no holds barred, and can give you that honest feedback, because the higher up in leadership you go, the less you get that type of feedback. And you don't want to be in that the emperor that wears no clothes type of situation. You want people to be able to give feedback to you. So if you set those three things up, that's key to your success. And to get into leadership, it starts with you understanding what it takes and start working towards that path and being intentional about pursuing those roles.
Yeah, your comment about not only having the education, but having that support says a lot. And also, the higher up you go, the less constructive criticism you get. And that's what we all need. We can all improve some way or another. So thank you for that.
Sure. And you have to be open to hearing it too. Right?
That's exactly right. Very true. What have you learned from being a nurse leader?
Ooh, I've learned a lot. As a matter of fact, I'm working on a book on just that, right? Because I grew a lot in nursing leadership. I recognized some of the things that I could have done differently. One big thing that I'm coming to terms with right now is I had just had this conversation. There's a lot more that I could have done in the vein of diversity and inclusion, particularly on the inclusion part. As a nurse leader, I probably should have done more to maintain and retain a lot of nurses of color. And because I am one, I shied away because I felt that it would seem a bit unequal for me to reach out to people of color, but they needed me. And that's one of the things that I take away that I could have done more of as a nurse leader. But I was also listening to a podcast about, which is why I'm doing this a lot, about lessons from NASA, people that worked in NASA and leadership. And one of the things that, key things that I learned from that podcast is that introspection and going back and reviewing what you can do differently is very key for leaders, particularly today. And realize that it's never a lost opportunity to go back and try to correct that mistake and own it. So, yeah, so that's a key thing that I'm doing now, and I hope to continue to do as a nurse leader, because we're human too. We make mistakes, and we need to be very open and be vulnerable in sharing that we are exactly that.
That's exactly right. We are only human. We have to be vulnerable, be open, and go back and learn from our, past.
Absolutely.
Yeah. So can you tell us, how can new nurses navigate the changing healthcare environment?
It's a tough time. So on one hand, we need as many new nurses that we can get, right? And we need to prepare them adequately. We have data at the American Nurse Association that our foundation conducted that indicated that our newer nurses are struggling, particularly during this time, compared to other groups. And it has a lot to do with the abbreviated education that they've had because of being called up to duty early. The transitions are very challenging. It was already challenging to begin with. That's why we had nurse residency programs. And now with a lot of the challenges and shortages with staffing, they're having to step up rather quickly, and there's less room for error. Patients are sicker, care is more complex. It's a very, very difficult time. But similar to my response about the support system that's needed, and sometimes I call it social capital that's needed for nurse leaders, I would say the same thing for new nurses. Latch on to a mentor that can help you through this challenging time. Make sure that you are learning as much as you can, not just relying on what your organization provides you in terms of education, but seek information out yourself and educate yourself so you can round out your learning, because a lot of what's being offered at place of employment are abbreviated. They're specific to the environment that you're in, that equipment, that patient specific information regarding the patient that they see. But you have to try and as hard as it is, because everyone's busy and it's so tough right now. But to round out your learning, you have to continue to read, and there's so many mediums available now compared to when I was in nursing school. There are podcasts, there's social media groups, all those. Take advantage of those and learn as much as you can, because that's going to help you. And when you don't feel comfortable with what you've been assigned or what you've been given, you have to speak up, even if there's a risk, because the risk is greater on the back end if you get to a point of making an irreversible error. So those are my three key things, the main piece of advice for new nurses entering the field. And by the way, we're happy to have you too. We need all of our new nurses. So thank you for choosing nursing.
Yes, definitely. And I want to point out, you mentioned how education, you want to continuously read and learn. After you graduate RN school and you're brand new, there is nothing wrong with asking questions. We all feel vulnerable, with asking questions, but just remember, none of your questions are silly. Like, everybody more than likely asks the same questions. We can learn something every day. So I respect how you comment, how you keep reading, you keep learning, because there's always something to learn. So thank you for making that comment. So tell us, why is a community like NurseDeck so important, especially now?
Well, NurseDeck seems to also be another equation, or part of the equation for support. Where there are resources made available, and it instead of you, a nurse, having to hunt and peck for information, they can actually set up. NurseDeck is set up like a one-stop shop where there's a lot of information that nurses can take advantage of to help their growth and development. So, it seems like there's also a community there as part of that is necessary for us to grow. There's some peace and solace that you get from someone else that may be suffering from or dealing with the same issue, a similar issue. Or you can actually lend a hand virtually to someone that's struggling with something that you've been able to conquer. So it takes a village to be a great nurse. And this is one village that I think is great for nurses to be a part of.
That's exactly right. Thank you for that. So what does quality health care and patient care safety, what do those two things mean to you?
Quality health care and patient care safety are, to me, is one and the same. I always talk about value, and value is based on what the consumer is willing to pay for, and what people need when they seek services from us is quality care. And quality is not just about the ultimate outcome, that whatever that was ailing them was dealt with and healed, but there should be no harm along the way. And there's harm can come in various forms. There's intentional and unintentional. Prescani speaks on that. And the unintentional harm are the things that we take for granted, where we're not communicating back when we say we would, call lights are not answered, patients having to provide information time and time again, where there's lack of communication. Those things are harm. And that's unintentional suffering that we have patients go through. So quality care is that entire spectrum where everyone's in sync, aware of the plan of care, working from the same hymn sheet, and gets the patient to an efficient outcome where that's agreed upon prior to discharge. And it's not that everything will be taken care of prior to discharge, but to set the patient up well after they do go home, so they can seek continued services to support their wellness. And nurses have a huge role in that, right? We are the folks that are there 24/7. So quality care and patient safety are one and the same. And it really boils down to not just not doing any harm, but also treating patients the way you like to be treated if you were in that bed.
That's exactly right. And you commented on communication, and communication is definitely an important factor there. So
yeah, definitely. It's the root of all errors. Medical errors is communication, right?
That's right. That's right.
The lack of.
So what are your thoughts about our healthcare system and the current handling of staff shortages?
Well, so it's a very tricky question. It's a great question. I guess to start this off, right, the staff shortages have always been an issue. It was an issue prior to the pandemic. It's more pronounced now because of, the wreckage of COVID. And it's brought to light the same way COVID has done everything else, right? Because we don't have a lot of new problems. It's exposed a lot of wicked problems that we never really solved. Staffing is a wicked problem that we never really solved, that got worse and is getting worse still due to the pandemic. The ANA declared the staffing shortage a crisis. Well, we're working with the government to declare it a crisis so we can leverage resources appropriately to deal with it as such. It doesn't mean that we're just awakening to the issue, right? It's just making sure that we have the proper language so that it gets the attention that it deserves, so it can be dealt with. Because this issue can no longer be fixed within the organizations where nurses work. We need a governmental response, right? We need a big business response. So that's what that is about. In terms of organizations over the years, and I worked as a CNO for a few years before I landed where I am. And it's always been a chess game, right? You get your numbers, where people move people around and everything else. Flu season has always been a challenge where you're borrowing, stealing for people to come into work. So it's not for lack of trying. Now, are there other things that could have been done to prevent us from being here? Possibly. The pipeline for us to have nurses to fill our gap is still pretty narrow, right? Because of what we're seeing on the academia side with lack of faculty. Leaders now are in this position where patients are there and you don't have enough nurses. It's an issue of supply and demand. And we have to make sure that we have a process where we understand the root causes of why we are in the predicament we are, looking beneath your feet to see what your organization can do differently or could do better to improve the work environment for nurses. Because a lot of the issues that we're seeing right now related to burnout, which is why nurses are moving with their feet, is because of these issues that have long been unaddressed. Or they were there, but because it wasn't a major issue, we had our staffing, we didn't pay attention to it as much as we probably should. So there's a lot of work to be done. There's so much that could be done. There's some variability from one organization to the other. from one state to the other, from one department to another, from one shift to another. But that's the approach and tactics that should be set up to help to start addressing these issues, because the key competitive differentiator right now for organizations is not the services that they provide for patients. It's about the type of service you can give. And the way you can set that up is to have an engaged workforce, and to have a workforce that really is robust, and they're present when they are at work. I've talked about presenteeism, where people show up but they're not really there because of all the other struggles. So there are all these things that have to be wrestled with at an organizational level at this point, where there should be a focus with shared governance on what to do about staffing, have nurses at the table to get to these solutions, and not just have all the action plans worked through in the C-suite.
Yes, you actually mentioned nurse burnout, which was going to be actually my next question for you. I want you to tell us, how do you feel about the current working conditions for nurses, and what ultimately can be done to help with this nurse burnout?
Yeah, the burnout is real. And I also want to say PTSD in nursing is real. And I'm saying that to nurses too, because we've heard from nurses that would say that diagnosis is not for me, it's for servicemen, right? It's for servicemen and women. It can be for us too. And we have not heard from servicemen and women that will say, no, you guys can have it because you didn't go to war. We're not hearing that. So we do have real cases. I got an email today from someone who is working with a nurse who's suffering from PTSD, that wants to see what we can do with Healthy Nurse, Healthy Nation. So it's a real thing. So as I mentioned, wicked problems. There are lots that's going on. And then, of course, you have a crisis. Like, when was the last time anyone was in a crisis that lasts almost 2 years? That's what we're in. So that's leading to burnout, where we're constantly in this mode of emergency disaster execution, because it's not preparedness anymore. And it's tiring. And patients are sicker. The demands are higher. Nurse abuse and workplace violence is more an issue than ever was before. You can't escape work. Everything's about COVID. When you're at work, when you leave work, on your way from work, where you eat, play, and pray, all you hear about is COVID.
That's right.
So yes, nurses are burned out, and it's a real issue. And we have to figure out ways to address this issue. But the first step also with nurses is to understand that, where they are, and being able to say that this is where I am. But institutions, that needs to be set up where structurally and systematically they are saying that I care about your well-being. For example, if you call out sick, if you call out, right, or if you're not at work, you're either you have a day off, or it's PTO, or you're calling out sick. But what about setting up a code where people can take a mental health day? And what message would that send to indicate that it's okay, so you're not making up the fact that you have a cough or a cold, right?
Right.
So, and that also signals that there's no stigma here. Like, you're rejecting all the stigmatization that occurs with saying that, I have to deal with my mental health. Right now, we jokingly say, I'm taking a mental health day, but we say it like in the shadows with our colleagues, but you don't tell your boss that. And the key thing is that managers need to be able to say to their teams, if you need a mental health day, tell me that that's what it is, and it's okay, because you deserve it.
It's okay to have a mental health day.
It's okay to not be okay.
Some people are so embarrassed. I work in the nursing home, and there are some nurses who are like, Jamie, I'm embarrassed, but I need a day off. I need a mental health day. And I'm like, why are you embarrassed? You're human. They're working you like extra hours. I would be burnt out too. So yeah.
Yeah, we with the socio-ecological model that we use for Healthy Nurse, Healthy Nation, we always say that self-care is a team sport. It's you, it's your family, it's your community, it's your organization, it's your support system. It needs to be embraced by all of you, because it's not just about what I need to do. I need people to help remind me of what I need to do when I fall off the wagon. And self-care is not a special event, right? It's something we should incorporate into our lives every single day. And it comes in its simplest forms. It doesn't mean that you have to go to a spa all day. You can set up a mini spa at home, light a candle, do some yoga stretches, close the door. That's your time.
That's
So
right.
that's part of what we have behaviors we need to unlearn, and there are new behaviors we need to learn.
I agree 100%. Thank you, Dr. Katie Boston-Leary, for your time today.
Thank you for having me. This was fun. Let's do it again.
Enjoyed it.